Okay, so good afternoon, everyone. And for people who come in late, good afternoon to you. This open enrollment webinar for Temple Beth Hillel is for plans beginning January 1st, 2023. We want to thank you all for taking the time. If you're doing this on the weekend or on the holidays or after hours, please remember that your broker team is available basically from 9 to 5 during most work days. We're also available by email if you ever want to email us and you want to have a private consultation. But with that, I want to go ahead and I'm going to go ahead and share my screen. And then I'm going to open up what you all are going to see when you go into the portal. So I put myself in as a test employee just kind of to run through the process of after you log in. It's going to want you to confirm, your information, your date of birth, your social, if you have a middle name. I'm going to put down I'm single, but of course I am not, but I'll do that today for the sake of brevity. I'm not disabled. I put in my address. It'll ask you to please put in a personal email and telephone number so that if we ever need to contact you, if that's the preferred method, of course, you can include your work telephone number as well. So very straightforward. All right. Then we go down here and it's going to walk you through if you want to add any family members, loved ones, dependents to your plan. Please do remember that this is open enrollment, so this is the time to add your eligible family members to your profile. It doesn't mean, however, that you need to add them to any of your plans, but it is important to have them added in case you ever do need coverage for them. If you need to come to your HR team or to us mid-year because you've lost coverage elsewhere, we call that a qualifying event. So if you adopt a child, if someone in the family gives birth, if they've lost coverage elsewhere, you're able to add that family member mid-year. But in general, you need to do that within 30 days. So you need to act a little bit quickly to at least contact us to let us know what your needs are in that regard to add that family member and of course get coverage for them. All of your pricing for all of your plans will always be in the portal. All of your information is here. Whenever you need to review any information, the portal is available to you 24/7. So whenever you want to remember what medical plan you enrolled in, the dental plan, the vision, any of the other information, all of that will now be available to you and transparent each and every day. We hope you take advantage of that. Your company really wanted you guys to have an enhanced access to all of your information and data so that while you're making your decision as to what you need to do this year, if you want to study this at home with a loved one or partner, you can go ahead and do so without having to feel like you need to get them on a call with us. We are, however, available, as we said, to speak with you and your partners if you want to do so. After you've added any family members, it's going to take you back over to the benefits. I'm going to start to go through the medical plan. And one thing I'd like to let everyone know is that all of the medical plans will be new for January 1 of 2023. What that means, in essence, is that we're going to need all of the employees to enroll or waive for any of the eligible medical plans so that we can ensure that your elections are proper to begin on January 1 of next year. We want to make sure that we capture any data regarding what plans you want to go into, what doctors or medical groups you want to utilize. So we'll go through that for a minute. You'll see what I'm going to do. If you click on the check mark, you'll see that it'll turn green. If you click on the X mark, you're going to see it's going to turn red. When you do click on the check mark this way, it's going to indicate that you're waiving. We will ask you to please indicate why you're waiving, right? Even if you choose just to be without coverage. As you all probably know, your company is incredibly generous. So a lot of the plan choices that you're going to have in here are literally going to have no payroll deduction.
I just wanted to interject really quickly to reiterate that TBH will no longer be offering medical plans under Blue Shield. medical plan offerings will now be either Kaiser Permanente choices or Anthem Blue Cross choices. So this is part of the reason why every eligible staff member will need to go through this open enrollment process. No more Blue Shield. It will be Anthem Blue Cross, or it will be Kaiser Permanente, depending on what plan you decide to choose.
Right. And just a brief note about that. One of the things that your company was very concerned about was about opening up the menu of available plans for all of the employees. There may be some employees who really enjoy the services that they used to get at Kaiser. Maybe they're on an old family plan. Those are going to be available. As well, we have some specialized products from Anthem Blue Cross that are really kind of interesting that we'll talk about in a moment. You'll see a box when you're in your portal, and if you click on the compare plans, you're going to see that there's a very simple way for you to compare all the plans side by side. If you go down to the bottom of the screen, it'll allow you to scroll over left and right if you want to do that and compare other plans side by side. And as well, you can export this data over to Excel if you prefer to have something like that kind of document available for you. We find it to be kind of handy for everyone. But this is a really nice way to look at the plan side by side, right? And so what you're going to see here, at least, is that many of the plans initially are going to have a $0 payroll deduction for you as the employee. Very, very generous, right? Please do note that when you add eligible family members to your plan, the prices for those family members will be automatically added if you include that family member in your medical plan. Obviously, as I indicated before, if you don't want to add that family member, right, that's not a problem. You're going to go to your portal, and assuming you had a spouse listed or a child, you would click on the X box if you wanted to waive that family member, or the check mark to agree. Over here on the side of the page, you're going to see a little shopping cart that's going to indicate to you the cost per month for your plans. Of course, your payroll deductions don't come out monthly, they come out per pay period, but we wanted to illustrate what would happen every month in terms of the cost for your plan.
Yeah, the other importance of having this portal for you is many of you already have gone into the portal when we did the enrollment for dental and vision. So most of your information is already stored in here. So you're not starting over. You actually have this information, and you should actually be able to jump right into doing some of your enrollment. If an address has changed, you're going to update that. But one of the reasons why we did this is to do away with paper applications, right? So you don't have to get a paper cut any further on our account. So most of this stuff will be in there in the portal. We utilize those forms if we absolutely need them to send them into a carrier, but a lot of the stuff is actually electronic, and some of it will even get electronically transmitted over to Principal, who is your dental and vision carrier, but they have some other product offerings that we're going to talk about today.
I just wanted to also mention that this process might be confusing for some folks. We do have some staff members that have become newly eligible that recently enrolled in the last few months. So I want to let folks know that this is the general open enrollment period time for all TBH staff. So even if you have recently enrolled in health benefits in the last few months, everyone should be enrolling and re-enrolling during this open enrollment process for an effective date of January 1st. So this open enrollment is for all TBH staff to re-enroll, reselect the dental and all of the health benefits, in addition to the new offerings that TBH has now. So everyone that received an email from me is benefit eligible, and whether you want to decline coverage or enroll, everyone must go through this open enrollment process. Part of the reason why we're also changing the effective date is so that so that all of your deductibles will be on a calendar year like your deductibles are, for the various health plans. So I just wanted to make this less confusing for folks, to just tell you, I know some people might be thinking, well, I just enrolled 2 months ago. Do I have to do this again? Yes, you have to do it again, especially if you're enrolled in medical, because we're no longer going to be offering Blue Shield. It's now Anthem and Kaiser. So so that's what open enrollment is for, and that's what we're doing now.
Thank you, Leslie. So I want to briefly go over one of the interesting new plans from Anthem Blue Cross. I'm going to briefly go over one of the Kaiser HMOs. There's other plans available. You're going to see them available down your list. Some of them are going to be very inexpensive. This Kaiser Platinum HMO happens to be 32 cents a month. I don't know how you can beat that kind of cost. That's pretty terrific. But let me go through for a minute and talk about this Anthem kind of new plan called Vivity. So Vivity is a relatively unique arrangement. It's been available in what they call the large group marketplace for employers who have more than 100 employees for about, 7 to 10 years, so quite a while. It's new in the small group arena. It's only been in small group for about a year. But the interesting thing about it is that rather than giving you a small network of doctors to work with, some of whom you may not know, this network, this plan uses primarily doctors at UCLA, Cedars, and groups like Providence for your care. So if you're interested in trying to get to doctors at UCLA and Cedars, for example, this is going to be terrific. One of the unique features of the Vivity platform is if you have a primary care doctor, let's say with Providence here in the Valley, and you need to get a higher level of care from a specialist at UCLA or Cedars, they will actually refer you to that higher level doctor without changing you out of your medical group, and allow you to stay with your current primary care doctor, but they will refer you to that higher end specialist if you want to be, for whatever that care may be. So as an example, we live out here in Woodland Hills. We have primary care doctors out in Thousand Oaks, funny enough, and here in the Valley. But my wife had some things she had to do last year, and all of her surgeons and doctors like that were directly at UCLA. You're able to go to those doctors directly, right, with a referral from your doctor without changing your primary care, whether that be your OBGYN or your internist or family practitioner. You're going to see there's a lot of benefits with Anthem Blue Cross. There's preventative care, and there's a way for you to look for your prescriptions. But let me open up the information on some of the benefits really quick so you can see how strong this policy is. This is a $0 deductible policy. What that means for you, of course, is that whether you're going to a doctor or hospital, there'll never be a deductible on this plan. There's no other deductibles for any other services, including prescriptions, and the maximum out of pocket that you or a loved one will pay each year is $2,500. And that includes every prescription, every doctor copayment, every cost for hospitalization, you name it. If you ever pay out $2,500 out of pocket, at that point, the plan maximum has been satisfied. And at that point, they'll cover 100% of all expenses for the balance of that calendar year. Any quick questions on that so far? Okay. As you probably know from your Blue Shield plan, when you sign up with an HMO, you're going to pick a primary care doctor, and that primary care doctor visit will be $15. And they're noting right here on your summary of benefits that you're not covered outside the network. So just remember, even though you're getting a very high level of care, if you pick UCLA Medical Group or Cedars-Sinai or whatever it may be, you're going to primarily be going to doctors within that medical group for your care. If you need to go to a specialist, it would be $30. If you need a diagnostic test or x-ray, it would be $25. And for an expensive test like a CT scan and MRI, those in general are $1,000 to $1,500. You're only going to pay $300 per visit. In general, if you need prescriptions, we want you to understand, and you've probably seen this before, they're broken down by what type of prescription you're getting. You'll see here that if you get a typical generic prescription under this plan, it would be $5. And if you want to get this through mail order, you can get a 3-month supply for $13. For tier 2 prescriptions, it's 25 and 75. Tier 3 are 75 and 225. And tier 4, what we would call specialty drugs, that would be $250, retail and home delivery. All right. If you do have an outpatient surgery, we want you to know that it would be $500 per visit. If you go to the ER room, it would be $500. What we do highly recommend is that you find out the urgent care for your doctor or medical group. So if you're signing up with Cedars-Sinai or UCLA, you're going to want to find out where urgent care is for them, because if you go in on the weekend when your doctor's office is closed, urgent care will only be $15 rather than $500 at the ER room. So we just want to make sure that you write down. What I tend to do is when I sign up for a plan, I take a little yellow piece and I put it on the back, a yellow stickum thing, and I put it on the back of my card saying, here's the telephone number for urgent care, here's where they're located, and here are the days they're open and the time.
Chuck, can you reiterate how we would find out if we're enrolled in an HMO, how we would find out the urgent care centers that are affiliated with our particular medical group? Do we
Right.
need to...
So when you get your ID card from Anthem Blue Cross, and or in the case of Kaiser, you can call them and say, please give me the address for your urgent care facility and the times they're open each day. Right? Sometimes the urgent care will be open after hours on the weekdays, and it'll be open all day Saturday, maybe a half day Sunday, right? But you're going to want to call your medical group that you chose for your primary care doctor, and they will immediately let you know the urgent care that's affiliated with their group.
Okay, so that's not something that shows on like Anthem Blue Cross's website. That's something that we need to...
I'll be frank with you, it is there, but it may take you 20 minutes to find on the website rather than just calling the medical group and asking them. We don't want people to get bogged down in the website. It's not, sometimes what is very straightforward to us because we do it every day is not as straightforward for the employees. For anyone who wants to know, they can feel free to email us or call us, and we can get that information for them. But we just don't want people waiting and struggling to go through the website to try to find, that urgent care facility.
Well, there's also the special number on the Vivity cards, right? So if anybody enrolls in what's called quote unquote Vivity, this is the plan that we were mentioning with Cedars and UCLA and Providence. There's actually a special Vivity concierge that you can call. Those people only handle phone calls for Vivity members. So you can actually get through very quickly, right? They are not answering calls for any of the other products that Anthem offers. So when you go to those people, and I've called them myself on the behalf of members, they have a good attitude, they're nice. No, I just mean, a lot of times you're struggling to call the claims department or something because you have an issue and nobody ever picks up the phone, right? I've had the experience of actually, calling over there and trying to get information for a member. We were tracking down a doctor to see if they were in the network because it didn't show somewhere. It didn't show the person on the UCLA website. So this person was concerned, like, hey, I might not be able to find my doctor. And so that's what we were doing, over the phone. But they're there to also identify those issues and also get you, in the right direction for claims. So it's a little bit more than just what is happening on some of the other medical plans. It's an extra feature that's included.
I'm glad you brought that up, Jonathan. So I think what I'm going to do is, after we're done with the meeting today, is I'm going to grab the brochure for the concierge service under Vivity, and I'm going to place it in the plans, in the portal for every one of the plans, so that if people want to contact the concierge at any time, so they can have that telephone number directly, in their portal.
Yeah, I think the other thing that we have different levels of Vivity plans in the portal this year. I think the other thing to mention is that maybe in the past, you want to put your dependents on, you don't want to put your dependents on, you're looking for a way to do that, I think that the Vivity plans are going to come a good option, a decent option for putting dependents on and still being able to get that high level care, at UCLA and Cedars and Providence, which may not have been obtainable for some people before. And I think that's going to be another thing that we strive for, with your employer to make that happen for this year.
Can you reiterate the plan that employees and their spouse and or dependents need to enroll in? If I enroll in a particular plan, does that then mean that my spouse and dependents need to enroll in that same plan?
Absolutely.
I'm glad you brought that up. So please understand that as the employee, the choice of plan is yours, and any family members that you enroll will also enroll in the identical plan. So we can't have you pick a different plan for your children than you're enrolling in. So if you choose to enroll in the gold plan, they're going to be in the gold plan as well, and the platinum as well. It all kind of follows what we call your eligibility as the employee, right? So that is something that you want to consider when if you are going to add family members, you're going to want to kind of add your family members, look at some of the plans that might interest you. And when you click on them, you're going to very quickly see a different cost for each of the plans so that you can, of course, make this within your budget. So the most important thing that we talk about with employees about coverage is we want you to be a very good consumer. We want you to make sure that the plans you're getting through the temple are of the best value for you. If you have a better opportunity elsewhere, something that's a better value for your spouse or for your children, our advice to you as brokers would be, we'd like you to take that. Our only thing that we want you to do is to be a very proactive consumer and get the best thing for your family, right? Remember, insurance is quite expensive, so it is very important to kind of be a good consumer. We hope you'll let us help you to plan for everything. That's what our consultative process is for. So in the email that went out to everyone is a little bit of information on how they can contact Jonathan or myself so that you can go ahead and have a 20-minute consultation, and we can maybe assist you to go through that process a little bit quicker with a little bit more information than you would have to do on your own. We found that a lot of the employees are really happy with that and enjoy that because we're able to get to a bottom line for them a lot quicker than they may be able to on their own. So if we could be of help, we'd really love to.
Thank you. We appreciate that. And I just want to also reiterate that if an employee enrolls in a particular plan, especially if it's an HMO plan, my primary care physician does not have to be the same primary care physician as my spouse and or dependents. The plan is what needs to be the same in terms of enrollment, correct?
Thank you. That's terrific. Yes, so that's exactly correct. Remember, if you want your primary care physician to be a female or a male, you can do that. Of course, for your children, typically you'll want them to go to a pediatrician, right? Maybe you're very happy with a provider in a certain group, but a different group would be better for your spouse or for your children. We just want to make sure that we get you to the right provider for your care. And please do remember, with all of these HMO plans, if we need to make a change, if you went to an office and they weren't friendly, they didn't validate your parking, or they didn't give you proper care, right? If we contact the carrier, or you do, before the 15th of the month, by the 1st of the next month, we can get you to a new medical group. So whenever you have an issue and you feel like you're not getting proper care, maybe unfortunately you go to a doctor and they spend 2 minutes with you rather than really learning about you and what's important regarding your health history. We want you to get that better care. So we would advise you probably get to another provider, right, who's able to spend more time with you to ensure that you obviously get everything taken care of. Thank you, Leslie. All right, so you'll see we've taken a little bit of time to talk about this plan. All right, this is just one of the many wonderful plans available for you. Oh, it logged me out, pardon me. Sorry. Okay, so I'm going to go back. I'm going to click this again. There's a gold level Vivity plan. This is a terrific option for any of you who wants to check out the price to add a spouse or a loved one to the plan, right? Your company is quite generous. And by you going with a gold level plan rather than a platinum level plan, some of the money that your company is allocated for you will actually carry over to this to help you subsidize a little bit of that cost. All right, so that's a terrific option. This plan, I'm going to open it up really quick. Again, it's a $0 deductible plan, but one thing you're going to notice immediately is that the platinum plan at a $2,500 out-of-pocket max, the out-of-pocket maximum on this gold level plan is $6,150. So potentially you could spend quite a bit more out of pocket, but in general, the benefits again are a very high level. $25 doctor visits, $50 for a specialist, very similar cost for a diagnostic test and for imaging. Prescriptions are a little more, 10 and 25 on generic. I think the other one was 5 and 13. All right. Outpatient surgical center, $500 per visit. If you are hospitalized, $500 a day for a 4-day maximum. So it's still an incredible deal. For a lot of you who might look at other medical plans on the outside, other than the out-of-pocket maximum being higher, most of the core benefits of this plan would be generally regarded at the platinum level. The only thing they did on here to really make it more costly is to make it have an out-of-pocket max of $6,150. So if you rarely are hospitalized, or if you do have someone in the family where you're doing some family planning, most of the time under both these plans, you're going to spend 1 or 2 days in the hospital for maternity care. Under both of these, your maximum out of pocket would be the same for that, $1,000. So we would basically say this would be a great way for you to cover part of the cost for your family members if you want to look at a gold level plan. Right? And of course, again, Jonathan and I would be available to help you plan for that if you do need to plan for an upcoming surgery, or if, of course, if you're planning a family. In addition to that, we have plans available from Kaiser Permanente. Again, the silver level plan from Kaiser is primarily available for people who need to add a family member, who need a lower price point, still terrific benefits. Here's the Anthem Gold Select HMO 30. The Select network of physicians, along with Vivity, basically comprise every medical group across California. So when you look at the Select HMO and you look at Vivity, between having Cedars-Sinai and UCLA and Vivity and the Select HMO elsewhere, you're going to have access to every medical group you would ever want. If you want to be in something outside of Cedars and UCLA, you like going to your neighborhood provider and they happen to be in the Select network, again, you're going to have a choice of both a gold level and a platinum level as well. The benefits are going to be very comparable to the ones that we just talked about under the Vivity plan. But in between here, you're going to see some other options. You're going to see a prudent buyer PPO plan that you can still enroll with at a $0 cost. We think that's incredibly terrific that your company is so generous with what they're doing and so that you're able to do that. And I'm just going to walk you through a couple of the plans from Kaiser so you get a better feel for that. For people who haven't been on Kaiser before, Kaiser's a little bit different model. They own and operate their own facilities. So they own and operate the doctor's offices and medical groups. Here's a typical gold $0 deductible plan from Kaiser. Again, you're going to see a $0 deductible. Again, very high level of benefits, a $7,500 out-of-pocket max, $30 copay to see the primary care doctor, $50 to see a specialist, X-ray and lab at $40 and $30, imaging at $250. Again, prescriptions as they typically are broken up by tier. If you are hospitalized, the facility fee is a maximum of $600 a day, but you see here now it's up to 5 days. So the Kaiser plans are still terrific, but they're going to have a little different design than the Anthem plans. So you want to pay attention to that when you're comparing plans side by side, in particular, if you have an upcoming surgery. Let me get to the Platinum plan from Kaiser. So this is your comparable Platinum plan from Kaiser. Again, $0 copay, pardon me, $0 deductible, a $4,500 out-of-pocket max. But a lot of people have told me, to be quite frank, it's very hard to get to the out-of-pocket maximum with our friends at Kaiser because the cost for Kaiser members is greatly reduced because they own and operate the facility. $20 copay for primary care, $30 for a specialist, x-ray and blood work, 30 and 20. You see here the cost for an MRI at Kaiser just went down. It's only $100 per procedure at Kaiser rather than $300 or $350 with Anthem. If you are hospitalized, the facility fee is a maximum of $250 per day up to 5 days. So again, a very high level of care with Kaiser. Any questions about the Kaiser plan at all?
I don't have a question. I do want to reiterate though to staff that in general, Maureen and I worked really diligently with Chuck and Jonathan to make sure that we were offering medical plans that were comparable to what we currently have with Blue Shield, and to even expand those offerings. So so there are plans that are definitely comparable to what the Temple is currently offering, in addition to offering Kaiser plans and whatnot. So I just want to let folks know and be aware that you know, no one's really losing coverage or losing the ability to still select the primary care physician and or medical group that you may currently be enrolled in.
And we would love the opportunity to help you go through that. So if you have a lot of questions, and you might, because these are brand new plans, we hope you'll take the time to contact us. So as long as we know the name of your preferred doctor or medical group, we can let you know what networks they're in. If you have a surgery or other concern, we want to assist you with that. Even if it comes down to, well, maybe you don't go to the doctor that often, maybe 2 or 3 times a year, but maybe a member of the family takes a lot of medicine and you want to plan out a better way to get the prescriptions at a low cost. So we'd love to help you with that as well.
Yeah, the only thing to keep in mind, if you haven't ever enrolled in Kaiser before, and this is going to be your first year, is just to keep in mind with Kaiser, you go to all Kaiser doctors. So you pick a facility that you want to go to, and that's the facility where you're going to obtain, you know, your services. Whereas with Anthem, right, we're picking Anthem providers. So, you know, Kaiser people are not going to go to Anthem, and Anthem people are not going to Kaiser. I know it sounds funny to restate that, but for somebody who might be choosing these options for the first time, it's just important to know where you're going to go.
So I'm going to go ahead. I happen to love Vivity because